Welcome back to the morning show here on Arise News with me, Katherine. Now, the World Health Organization has recently released a report stating that worldwide, 60 to 90% of school children and nearly 100% of adults have dental cavities. With statistics like that, it's unsurprising that oral diseases continue to be a major public health problem in the African region. Oral diseases are a source of considerable pain, suffering, and disability for many, especially the poor and deprived, and oral illness management represents a significant portion of health budgets worldwide. A new way of interpreting and responding to oral health problems in Africa is long overdue. It should begin with a systematic, evidence-based interpretation of oral health information through the application of basic epidemiological principles at the most local level possible. And my first guest prides herself on her ability to put smiles on people's faces by relieving them of pain and transforming their lives through various restorative and cosmetic procedures. Welcome to the morning show, Dr. Katherine Njorteah. How are you?
Thank you, Katherine. Thank you for having me on your show.
So nice to have you here this morning.
Thank you.
So we're talking oral hygiene, but I do have to call attention to these wonderful props that you brought here.
I know.
What are they exactly? Talk us through it.
Right. So this is what you call a dental model that shows you the entire dentition in the mouth. And we know that most times people come down with dental issues, mostly because of poor dental hygiene.
Right.
So it's important that you teach people the basic things they need to know in taking care of their teeth, so that as much as possible, you don't have to come down with dental issues.
Yes.
We also know that in this part of the world, dental awareness, it's not, very significant. And we do our best as dental practitioners to preach that, good news to them, that you can actually see your dentist, have routine checks done. But when you get back home, there are little things you can do on a daily basis to ensure that you keep your mouth clean.
Okay, so what are these things that we can do?
So the first thing you have to do to ensure you have good oral hygiene is to ensure you go about your brushing properly.
Right.
Now, brushing has to be done effectively and sufficiently.
Okay.
You do not want to brush for a short period of time, and you want to ensure that you're getting to all the areas
So what's
possible.
the perfect length of time to brush? Let's start there.
Dental practitioners would usually advise you to do minimum 3 minutes, so that you have at least 1.5 per arch. The upper arch, 1.5 minutes, and then the lower arch, 1.5 minutes. I'm going to demonstrate to you the effective way to go about brushing your teeth. Most times we do it so hurriedly because there's no time really to spend in the mouth and all that. But there's some things you have to bear in mind. First, the manual dexterity required for brushing.
Right.
The tools for brushing, namely your toothbrush and your toothpaste. As much as possible, we do not advocate for brands and all that. We would always tell you to go with products that you're comfortable with.
Right.
And, ensure that these are products that can actually effectively clean for you. Now, if you're going to brush your teeth, you have to bear in mind that in the mouth, you've got the gums and different surfaces of your teeth. You have to ensure that your toothbrush will be able to get to all these areas, especially the difficult-to-reach areas, the back teeth. And these are the teeth that usually come down with cavities. So in brushing your teeth, you have to ensure that your gums are being massaged.
Right.
And thereafter, you move away from your gums.
So I want us to let's get a close-up shot of these teeth so we can really see how to do it. So you massage the gums with the toothbrush. So you bear in mind that you're massaging your gums and at the same time sweeping away from your gum lines to ensure that every part or every surface of your teeth is effectively clean. So I have to stop you there. Let me ask a question, because when you go to, well, the dentist or even just a regular store to buy a toothbrush, I generally pick quite a hard toothbrush. Now, if I'm massaging my gums with that, I feel like I'm going to end up bleeding. So what's the preferred strength of toothbrush to use in effect?
So we would usually advise to go with the soft or medium bristles.
Right.
These ones would not easily cause recession in your gums, and these ones are gentler on your gums. You found out that most smokers, for instance, will want to go with the hard toothbrush. Oops. So you might want to watch that really, because at the end of the day, no matter how well you think you've brushed your teeth, you're always advised to see your dentist for a professional cleaning. We are able to get to those areas and clean effectively for you. So back to the brushing technique again. You massage your gums and then sweep away gently from the gum line and, just towards the tips of your teeth. And you also ensure that you're going to brush all the chewing surfaces of your teeth. Otherwise, these two will come down with cavities. And of course, your tongue should not be left out of the cleaning action.
Okay,
well.
so if you were to describe to us or show us exactly how to brush the tongue, because I know a lot of people aren't even aware that that's a place that really needs to be focused on, because that's where all the smell comes from.
Yes.
So talk us through exactly how, well, let's pretend there's a tongue there,
Right.
how one would brush the tongue.
So very important, you have to ensure you stick out your tongue as far forward as possible.
Okay.
And then, from the back of your tongue, you're sweeping away towards the tip of your tongue. Scrubbers. Now, that's the only area where we'd probably say you need something slightly harder. You actually have tongue scrapers or tongue cleaners that can actually help you do this.
So you recommend actually using
please.
these scrapers?
Yes, you're allowed to use tongue scrapers or tongue cleaners, and you move from the back of your tongue towards the tip of your tongue, just scrubbing away gently, because like you rightly pointed out, if you don't clean properly, then you're more likely to come down with bad breath, which is one of the commonest things dental practitioners have to deal with. But we have to bear in mind as well that, brushing is not the only reason why you would, or poor brushing rather, is not the only reason why you would come down with halitosis. There are a lot of reasons why people come down with bad breath, okay? Starting from the diet we take, you have to be careful that when you take diets or foods that are highly odoriferous, we like to put it that way, you want to be able to rinse or brush immediately.
Right.
We also advise that you take care of dental issues like cavities, gum disease, gum problems. These are little things that you want to get out of the way so that you don't harbor bacteria in your mouth that would eventually give rise to bad breath. Okay?
Right.
And then there are also instances where people are on chronic medication. You have to be careful with that as well. There's actually a mouth-body connection, and that's why we always encourage see your dentist from time to time, because early detection is key in most of the conditions that go on in the mouth. We found out that from oral examinations, you're able to pick out some systemic things that are going on in the body. You're able to pick up diabetic patients, hypertensive patients, and these are little things you want to get your dentist to be able to get out of the way for you. So medications, too, could be attributed to...
So I want to talk about teeth whitening for a second.
Right.
Now, a lot of people are wondering whether or not they should whiten their teeth. Generally, things that you eat tend to yellow them.
Yes.
But does it damage the enamel of the tooth?
Now, because
that is quite it's a consideration to bear.
Yes. Now, because you have so many options and so many products out there for whitening the teeth, people are usually tempted to just reach out for the first product they see. But we don't advise you to do that. It's always important to go back to your dentist to be able to guide you through these options that are available, because not everybody is actually a suitable candidate for whitening. So by the time your dentist examines your teeth, your dentist is able to tell you which of the whitening options would work for you. And like I said, you can actually opt for what we call veneers as well. You don't necessarily have to do whitening if you have sensitive teeth already. So your dentist should be able to guide you on the right options for giving you that brighter, whiter smile.
Amazing. So for those of our viewers that want to get a brighter, whiter smile like yours, how can they keep in touch with you on social media?
All right, you can catch us at Smile360NG on Instagram and www.smile360ng.com for more information on the various services we render, from cosmetic procedures to preventive procedures, because at the end of the day, if you're able to get your teeth healthy, then you can actually boast of having that confident smile that you've always desired.
Absolutely. Oh my goodness, you put me to shame. I'm getting my teeth whitened ASAP.
I look forward to seeing you soon.
Thank you so much, Katherine.
Thank you.
It's time now for a short break on the morning show, but when we return, I'll be speaking with a cosmetic doctor about African aesthetics. Don't go away.